Okay, everyone, thank you so much for coming. And I'm gonna real quick give it to Nawal, but just want to do a quick introduction. So Nawal Umar is a policy analyst at SICUS, Sex Ed for Social Change, where she works on monitoring legislation that seeks to either advance or restrict sex education and publish key publications to promote their advocacy and goals. She received her master's in public health from Columbia University, where she specialized in sexuality, sexual and reproductive health, and worked on her thesis proposal that explored parent-teen communication about sex in Muslim American families. She also worked as a sex educator in the past and continues to advocate for comprehensive sex education and reproductive rights for young people, especially within her own community. So Noel, thank you again so much for joining us and being able to put on this presentation for us, because this is something that's very needed to talk about. And I'll give you the floor.
Yeah, for sure. Thank you so much for having me again, and thank you for the appreciation in the chat. Let me start sharing my screen. It's been a minute since I've done a presentation, so let's see. Let's see. Okay. Oh, do we see my screen? Do we not see my screen? Do we see my screen now? Feel free to give me like a thumbs up in the chat.
Yeah, we see your screen.
Awesome. Okay, so let's get started. So as you can see today, we're gonna be talking about the importance of sex education advocacy for South Asian young people, especially as medical professionals. So I'll start with the table of contents, because I think it's great to have sort of a roadmap for where we're starting and where we're going to end up, as well as if you're counting down the minutes to the end of the presentation for whatever reason, then you'll know when we're kind of getting close to the end. But we'll start off with the introduction to who I am and my work related to this field. Then we'll talk a little bit about what is comprehensive sex education, why do we need to be advocating for it, and then we'll talk about barriers, common barriers, both administrative and cultural, that people have in accessing school-based sex education. And then we'll end it with tips and resources for future medical professionals. That would be y'all. And so let's get into it. Ooh. Okay, so an introduction to myself. My name is Nawal Umar, she, her pronouns. I work as a policy analyst at SICUS, Sex Ed for Social Change. And while I'm there, I do a lot of monitoring and tracking legislation related to sex ed, but also related to other sexual and reproductive health policies. And I also work on key publications like our legislative summaries, as well as updating our state profiles that kind of give a snapshot of what sex education looks like on a state-by-state basis. And how I got here, I did my bachelor's in public health from UT Austin, and then I did my master's in public health from Columbia, where I got a certificate in sexuality, sexual and reproductive health. And while I was there, my thesis proposal, as Ali Asghar mentioned, was on parent-teen communication about sex in Muslim American families. And beyond that, my research interests include advocating for comprehensive sex ed, reproductive justice, and sexual health, resolving sexual health disparities. In my prior experience, I've worked as a sex educator for a K-8 school, and as a peer health educator, as well as I've done a little bit of qualitative public health research, not in sex ed, but something equally as important. And in my personal life, I'm a proud Muslim, Pakistani American. I spent most of my life in Texas, and I now, since then, have relocated to the DC metro area. And I feel like my faith and identity have a lot to do with informing the work that I've been doing and the kind of the work that I aspire to achieve within my own community. So with that, let's get into what is comprehensive sex ed. So I think before we even get started talking about what is comprehensive sex ed, it's important to note what is just sex education overall. The sex ed is a form of instruction in human development or any other topic related to sexuality that can include a variety of concepts like anatomy, puberty, contraception, etc. And there's many avenues through which this can be provided, but typically the one that I'm going to be most referring to is school-based sex education. But I will make references throughout to sort of the sex education that you do on the field during patient-provider relationships. So getting into comprehensive sex ed, so according to the National Sex Education Standards, which SECUS, the organization that I work for, and other partners have developed, comprehensive sex ed instruction and sexual and reproductive health knowledge, among many things, is evidence-based, age-appropriate, culturally inclusive, LGBTQ plus inclusive, trauma-informed, and sex-positive, and it can cover topics such as the ones mentioned on the screen. And so you might be saying, well, this is all super great, and if this is what comprehensive sex ed is, it might be the case that this is the go-to curriculum for most schools. But if you are like myself and grew up in the South or anywhere that's not California and New York City, you can definitely vouch for the fact that this is not the sex ed that you received, and if any at all. So why is that? And the answer to that is abstinence only until marriage programming. So historically, abstinence only until marriage programming has been federally funded and promoted in school curricula without realizing or recognizing the harmful implications it can have on the health and well-being of young people. And so why is this? So the first problem with abstinence only until marriage programming is there's no discussion of contraceptive choice beyond abstinence. Abstinence is usually mentioned as the only method to prevent pregnancy and STIs. Beyond this, it's often sex negative. So sexual activity outside of marriage is often stigmatized. It's also not LGBTQ plus inclusive. It's usually a very heteronormative curriculum that doesn't address the concerns of LGBTQ plus youth. And there's also critical information on how to access reproductive health services. It's often withheld. And beyond this, it's also empirically proven to not lower teen pregnancy rates or STI rates, which is what it has been set out to do. And it also has no influence on delay of initiation of sex, number of sexual partners, and other sexual risk behaviors. So this kind of highlights the importance of why we specifically want to advocate for comprehensive sex ed that actually seeks to promote the health and well-being of young people and help them make more healthier and informed decisions. So what is the status on school-based sex education? On a federal level, there's not really any federal law currently that mandates sex education or any federally set standards for sex education. However, the Real Access and Education for Healthy Youth Act is a bill that was introduced by Senator Cory Booker and other fellow legislators, and it seeks to promote programs and services that advance comprehensive sex ed. And if it were to be enacted, it would essentially provide federal funding for these programs and eliminate federal funding for abstinence only until marriage programming. And if you have more questions about that, feel free to contact or connect with me after this call, as my organization does a lot of work related to this federal bill. But on a state level, 32 states and DC mandate sex ed. 38 states mandate HIV education, 34 require abstinence to be stressed in sex ed, 16 states require instruction on condoms or other contraceptive methods, 13 states don't require their sex ed to be evidence-based or medically accurate at all, and 6 states actually require explicit discrimination of LGBTQ plus people. And there are some states like California and Illinois that have their sort of own versions of the Healthy Youth Act, which would require them to teach comprehensive sex ed. But I think in Illinois' case, it depends on, there's no requirement to teach that sex ed. So if they teach that sex ed or if school districts teach that sex ed, then it has to be comprehensive. So given that, what are some general barriers to receiving sex education? So first, considering administrative barriers. Sorry, I have Ramadan brain right now. But so the first being lack of sex education being a graduation requirement. Oftentimes school districts, schools don't have it as a requirement and don't have a class for it in their school to begin with. So that's probably the biggest barrier. The next barrier is a lack of training for educators, as well as a lack of availability for sex educators. And this can be seen, I'm sure y'all remember Mean Girls, where there's a PE teacher teaching sex ed. And definitely there's a lot more qualifications required to teach sex ed. So a lot of teachers often feel unprepared to teach sex ed, as well as some states specifically disallow or prohibit outside sex educators from coming into the school and being able to teach sex education. And then next, lack of funding. Oftentimes you'll see sex ed is the first to be cut out of funding when it comes to other things being defunded. And also during the pandemic, when everything switched to a virtual format, we saw that sex ed was kind of the first to be knocked off the curriculum. And the last administrative barrier being opt-in versus opt-out system. So this is specifically reflective of the system of enrollment to sex ed. So in an opt-in system, all parents have to sign a permission slip for their child to be included in sex ed instruction. In an opt-out system, everyone's already automatically included, but can be removed if someone fills out a written consent form. And so clearly in the former method, it's a lot more restrictive. There's a lot more barriers. Parents have a million permission slips to sign. So it often gets kind of left out, or people end up not receiving that sex ed. So with that being said, what are some more cultural barriers, especially when we think about our South Asian community and the larger AAPI community? So the first barrier that I kind of came across when I was doing my research and just anecdotal, as well as in my work that I do, is a parental misconception of sexual activity. So there's a discrepancy between actual sexual activity and what parents may think their kids are doing. A lot of kids don't think their kids are having sex. And so this can come from cultural or religious norms that of abstaining from premarital sex. And because of this, many parents don't think sex ed is relevant to their kids because in their eyes, their kids aren't having sex. Or for example, when we consider, the patient-provider relationship, a parent might not think that sexual health intake form is necessary if their kids aren't having sex, right? And so that's one barrier. The next is just a lack of open discussion about sex overall. This idea of we just don't talk about sex in our families. And this can also come for a variety of reasons in different cultures, such as sex being considered a more private or personal topic. And as well as parents themselves feeling like they've never discussed sex with their own parents. So like, why would they feel unequipped to discuss it with their own kids? And of course, parents want to be that sort of first resource for their kids for this kind of information, but oftentimes they avoid it because they don't really know how to go about it, or unless it's absolutely necessary, then they bring it up. And this kind of leads to a broader point, which is the third barrier, which is perceived stigma and shame that's associated with sexual health. So because of this lack of conversation, because of this kind of sometimes sex negative mindset, and this messaging and sometimes a tone that we use in our community to talk about sex, many youth feel embarrassed. Either they don't feel engaged when they're in sex education, or they feel embarrassed bringing up sexual health concerns with their respective medical provider. And the last concern would be concerns about increased accessibility to sexual health information. So this can present itself in the fact that some parents think, well, talking about sex will make them want to have sex. And this idea has actually been proven to not be the case. And you can see this when we talk about comprehensive sex ed. It's shown that the more that we talk to kids about sex, the more likely they are to engage in healthier decision making because they have all the information they need to really critically think about whatever they want to do. And it actually has been shown to delay initiation of sex in young people. So those are some things that I've noticed. I would love if y'all could I haven't used Poll Everywhere since I was teaching sex ed online. So feel free to let me know if this is not working. But if you could just mention cultural barriers that you have noticed or felt when you were trying to receive sex education. And let me know in the chat if it's not working. Don't be shy. Feel free to, and if not, you can also in the chat, like if it's not working for you, feel free to just in the chat mention some barriers. Thank you so much, Patrick, for sharing that in the chat. Yeah, feel free to, if not, it's fine. If you can't think of any other barriers besides the ones I mentioned, but I'm sure there's many. I'll give it like 2 more minutes. Oh, awesome. We have one. Assuming sex doesn't happen before marriage, definitely a big one. That misconception. Yeah, I definitely heard that. Infantilization trope, definitely. Judgmental peers, 100%. Yeah, no, these are awesome. Don't need HPV vaccine. And we're going to talk about that one specifically in a bit. Awesome. Yeah, thank y'all. That I'm glad that that actually worked. Okay, we got one more. Assuming that anything related to general areas an appropriate topic, 100%. Thank you all for sharing that. Let's see if it lets me go next. So with that information, what can y'all do? So as a future medical professional, there's many ways that you can advocate for sex education and promote a more sex positive approach to your practice. And oftentimes, medical provider is kind of that next avenue where a lot of young people can get sex education, especially when other avenues fail to do so for them, whether that's parents not being able to, or whether that's schools. So given that, some tips for future providers. The first is advocating for school-based sex education. So doing so, it empowers your pediatric population, and it also acts as a measure of prevention. And so there's many ways you can do this. You can get involved with state and local organizations in the state that you want to practice in. And if you want more information on this, I can connect you with the right people. And I'm going to leave my email on the last slide. But you can also do like a quick Google search and look for nonprofits that are working in sex education. It's a very niche field, so you should be able to find it. But definitely doing that. And I think it's also important to consider that many organizations like ACOG, AMA, APA have come out also in support of advocating for comprehensive sex ed. So it's important to do so on an individual basis as well. The next thing I would say is changing the way that you practice. So this can be, consider the many ways in which AAPI communities have kind of suffered from health disparities, especially when you destratify data. And so, for example, the suspected high prevalence of PCOS amongst South Asian women. This is something that's been studied in the UK and New Zealand. The US still hasn't replicated these studies, which I think points to a disparity in itself of just the sheer lack of literature that exists out there on health disparities for South Asian communities. But I think it's definitely important to consider that as a medical professional, we don't want to perpetuate these same disparities, as well as we want to make sure that we're having a sex positive and non-judgmental approach to our patient provider interactions so that young people feel comfortable coming to you and asking you or disclosing their own personal information about sexual health concerns they may have, and giving you that opportunity to provide sex ed. And so some of you might feel kind of unequipped to do this. How do I get engaged? How do I get more information to be able to do so? So that would be get trained. There's many organizations that offer training opportunities. Physicians for Reproductive Health has a program. American Sexual Health Association has a program. American Medical Student Association has a program as well. And they offer training opportunities for medical professionals to get more expertise in sexual and reproductive health. And I've linked their specific programs actually in this slide deck. So if you want more information on that, I can also send that over to you if you email me, or I can give this slide deck to Ali Asghar and he can kind of disseminate it. But I think those are great ways for you to get more expertise and feel more comfortable being able to give this kind of information to your patients. And then lastly, it would be engaging with parents and community members. So especially parents, when we consider our pediatric population, being able to engage with them, whether it's through nonprofit work, whether it's through community engagement opportunities at your workplace, whether it's through interpersonal interactions. A lot of that will create a more sustainable impact in the communities that we're working towards, and kind of alleviate those cultural barriers by improving, comfortability, visibility, and so that people don't have to be prevented from accessibility to reproductive health services. And then, so Q&A. So thank you so much to the people that filled out the Google Forms. I tried to encompass most of the questions throughout my presentation, but I wanted to highlight 3 specific questions that were a little bit more detailed or a little bit more specific. So the first question was, what's the best way to convince more conservative Asian parents to give their child the Gardasil vaccine? And so I think this is a great question. One of the biggest barriers to this is cultural misconceptions about the vaccine. And I think someone highlighted it in the poll everywhere as well. So I think that's the first step, is dispelling some of the myths that we have about the vaccine. I'll give you sort of a personal anecdote. When I was in 7th grade or 8th grade, I think, and like my provider had first brought up the vaccine, they had kind of immediately qualified it with like, oh, like if they're sexually active, then they should get it. My Pakistani mom, bless her heart, she didn't know much better. But she was like, well, my child's not sexually active, so they don't need it. And so as you can see, that was kind of a barrier to me being able to get it at the time. But I also think the doctor at the time could have done a better job of sort of maybe probing or giving more pertinent information that would have felt more relevant to my mom. Such as, even if they're not sexually active now, they might be sexually active in the future, or that, this is one of the few methods we have to prevent against cancer. And I think if they had said that, then my mom would have definitely been more on board. So I think definitely highlighting that, as well as there is some parents who may think that getting the HPV vaccine is sort of a green light to sexual activity, and that's been proven to be false. If anything, HPV vaccine has been shown to correlate with other safer sex behaviors. So that's a fun fact. But you definitely don't have to get into that much detail if the parent already seems a little bit unsure. But yeah, I would say dispelling the myth, and then also just highlighting again that, it's preparing your child for the best future. And also it's one of the few methods we have to prevent against some really severe forms of cancer. I think that that is probably the best way to go about it. I will say in some qualitative research, it's less and less becoming cultural reasons and more becoming just in general, like vaccine hesitancy, which is kind of a more detailed, which is a bigger problem that I don't really have much time to discuss, but I hope that answers the question for the most part. The next question is there a way for providers to test for STIs without it showing up on insurance claims? So this is a very good question, although it's definitely not really my scope of knowledge. But I will say this is something that many adolescents fear. And the person that asked this question did a really good job at addressing the fact that clinics like Planned Parenthood and other similar clinics that offer, they can offer low cost testing or even free testing. But oftentimes, adolescents don't have freedom of mobility. They may lack transport, so they can't really access these resources. So in that case, I would say the first thing is it depends a lot on who your health insurer is and also what state you live in. So what I mean by that is, in I think California has a law that a health insurer is required to ask required to ask if you would like the patient would like their explanation of benefits to be sent to an alternate address or alternate email address, especially if it's for like sensitive care. I think sensitive care is qualified as like mental health care, as well as like STI testing and other health services. And then beyond that, a patient can definitely contact their own health insurer and ask, how, if their explanation of benefits will be itemized, if it's held confidential, if it'll be put in an online platform where their parents could potentially see. But I think the unfortunate part about it is that most teens often do have to resort to either paying out of pocket or trying to access these low cost services. And I think that speaks to a bigger issue that we need to consider in terms of policy, in terms of healthcare reform, when we want to think about improving accessibility for adolescents. But I hope that can answer it as best as possible. The last question is, sometimes our parents say it's not in our culture to discuss that. How do you approach these conversations while still being respectful of their beliefs? I think that this is a great question. It's definitely a very tough one because in all honesty, I'm still trying to figure it out for myself. I think that, so I can speak from my own experience. When I was growing up, sex was not something that was really discussed. I remember, and I think someone mentions in the chat, I remember when my mom got a notification from the school that we would be learning some warped form of sex education. She was kind of like, oh, well, like, do you want to have the talk? And I was like, I already know everything I want to know. The internet, so no, thank you. Like, it's fine. It was kind of a little bit late. But I think over the years, my education and my experiences kind of helped me try to slowly open that subject with them. And like, while initially uncomfortable, my parents have slowly opened up to the idea of talking about it. And I definitely can see, like, with my younger siblings, they're a lot more forthcoming about these topics. And I think that what personally helped the most in this situation was kind of asking them about their own experiences, asking them very open-ended questions about, what was the sex ed that they received, or even just asking them like, how'd you learn about puberty? What was that like? And oftentimes what you'll find is that they also did not have the best experiences and they don't have much to go off of. And that kind of makes them feel unprepared to have these conversations with you. So then sometimes they'll just automatically resort to, well, it's not in our culture to discuss that. So I think that definitely, in short, exploring, canvassing, asking them, why they have, what kind of sex ed they might receive, or just asking these kind of open-ended questions without sort of pressing your own beliefs on them, you'll find that they kind of also realize the sex that they received was not great. And it's kind of like slowly brainwashing them into like recognizing that change needs to be had. We just don't know how. But that's my own personal advice. I feel like I'm still trying to get there with extended family, but hopefully that helps you a little bit in trying to navigate that. So are there any other questions that I didn't get to? Feel free to like ask now in the chat. And if there's like a more detailed question that I don't really know the answer to, I can always connect with you afterwards. I'm going to leave my email in the next slide, so you'll see, you can easily contact me with more questions. But yeah, feel free to ask in the chat if there's any additional questions. And yeah, if you want to answer anonymously, feel free to use the Google form. And Eliasco, you can tell me right now if someone's asking something, or you can always tell me afterwards if there was more questions and I can answer them over email. Anything else? No questions? Alrighty, well, thank you so much. Thank you for allowing me to impart some knowledge on you. Thank you for allowing me to learn from y'all as well, especially through the poll everywhere. And if you have any further questions, again, my email is down below. Feel free to email me there, as well as hopefully I can get the slide deck to you if anyone would like the slide deck for more information and for some of the resources that I shared. But yeah, no worries at all. Oh, yes, no problem. Yeah, awesome. Eliezer, I will turn it back to you.
Thank you so much, Nawal. This was a really great presentation.